and fly away with me. Come and fly away with me. Come and fly away with me.
Queen of moderation.
Hello there, I'm Nerf, or Nerfy if you know me, and in this video series we're going to talk about Lynn Rieds' medical issues that I'm calling Ambies mini ailments. Now, before we begin, I want to state that I'm going to do my very, very best to keep my personal opinion about if she has something or not out of the following videos, other than poking fun, of course. However, I am going to break down what these medical issues are and what she says she has experienced. You know, a really fun and easy way for us to see if she's full of it or not. Please keep in mind that this woman knows better than not just us, but the doctors and nurses that have worked on her as well. I will have all of my sources in the description below because, unlike our girl, honesty and transparency is important. We're going to go through these medical issues 3 at a time in each video. 2 big ones that she says frequently, and then a little quirk, a little one that has been mentioned once or twice and was backpedaled on, or where she's just contradicted herself. So I invite you to grab some tea in your snowflake mug, grab your narc alert blanket, and put on your Omegon shirt, and settle in for the very first installment of Ambies mini ailments.
Cellulitis moment.
10 times. 10 times. I can't believe the number either. But after combing through videos and going off of Ambies numbers alone, she has had cellulitis 10 times. And I am being generous, and I shaved off 3 or 4 times where I was not sure if she was saying she had it or if she was just mentioning it from a time before. So, what causes cellulitis? It usually happens when bacteria sneak into our skin through cuts or scrapes or cracks in the skin. The culprits are often not so friendly bacteria called Streptococcus or Staphylococcus. If you have a weakened immune system or certain health conditions, you might be more at risk.
You have cellulitis. And I was like, what? And how they explained it to me then was it is a infection in the blood.
Well, not quite, Ambi. Left untreated, the infection can spread to the lymph nodes and bloodstream and rapidly become a life-threatening illness like endocarditis, toxic shock syndrome, or sepsis. These and cellulitis require a medical diagnosis, usually not an Ambi telling the doctor what she has. Another contributor can be athlete's feet.
But I have cellulitis again. I didn't want to share it that way. Again, this is gonna be another TMI moment, but I do have athlete's feet. I know that's so random, but I have athlete's feet, and that is a major cause of cellulitis. Google it if you have to. Talk to your doctors if you have to.
Funny how you told us to Google it with a shit-eating grin, because I did. And while it can be a factor when there are no other factors present, or it could be a predispositioning condition before cellulitis, when the fungal infection isn't being cared for properly and results in an open wound, that means that if you are saying your cellulitis is purely because of your athlete's feet, you were not caring for it and it became an open wound. Not quite the win you were hoping for. Now, was it?
It was probably utmost to 2 months now.
I'm sorry, I don't mean to be this person, but you mean at most, not utmost. Utmost means greatest or the highest in the context of I have the utmost disrespect for a certain girly. Oh, what am I saying? You're a writer, aren't you? Anyways.
Dana and Destiny were sleeping over, and the mattress was in the living room because I was out there and I had to sit on it while we were hanging out. I know, it's pathetic. And we were all about to go to bed. And we were all up and cleaning. And I walked past the mattress, and I don't know how, but my baby toenail, like I said, I don't want to share any of this, but I feel like I kind of have to. I'm tired of people worrying. So my baby toenail hooked on to the mattress and bent backwards, if you will. I started freaking out. I was gushing blood. I was so scared. Becky almost passed out at one point because one, she doesn't do toes. How it looked was disgusting. Blood everywhere. My actual pinky toe was like crooked. It was honestly super scary. But thankfully, Destiny was like, I'll fix that for you. So it was like a whole thing, okay? She did the best she could. I was like crying and freaking out because like it hurt. So my whole toenail came off. Hi, nice to meet you. And I did everything I could to keep it clean, Band-Aid, Like I did everything. I did a lot of research.
So how do you know if you have cellulitis? Well, it comes with a set of symptoms. Picture this: redness, swelling, tenderness, not to mention the blisters and the weeping, discolored skin. Sometimes the infected area even feels warmer than usual, and in some cases you might experience fevers and chills. Doctors very seldom need to run blood tests or urine, as it can be diagnosed visually. Handy piece to remember. And according to Amber, nearly every single time that she's had it, it has been a very serious case. Now, how fast does cellulitis come on, and how long does it last?
I think I have one antibiotic left. Cellulitis for me, it comes on at the speed of light, but then it goes away really quickly because I take care of myself. Like as soon as I get it, I know exactly what to do.
Oh, so close, Ambi. The truth is it can start in a small patch of skin and spread extremely quickly if left in an unhygienic environment. Yes. And it takes weeks to go away. It doesn't matter if you've had it 10 times or if you've had it once. The course of it is the course of it. And usually you're on antibiotics for 7 to 10 days when the swelling and the weeping of the wound and the discoloration could last for several weeks after the fact. Okay, let's talk about the care of it. First and foremost, don't ignore it. Seek medical attention.
Because I've had cellulitis before. I've had it twice. I was in high school both times.
Funny, you've had it at least 4 or 5 times by this time, from what you've said anyways. Your doctor might hand you a prescription for antibiotics to tackle those pesky bacteria.
I hate medicine. If I'm prescribed something and if I truly don't have to take it, I won't take it. In the past, I have been prescribed things for my anxiety more times than I can count, and I won't take it because I am afraid of medicine.
This is coming from a woman who's had no issue vaping for a number of years while talking down to those that did. So she was not taking meds, but she had no issue with that Delta 8. Did you, Ambi? Rest up and elevate the affected area to help with the swelling.
Because I've been having to do some bed rest.
And of course, manage the pain with over-the-counter relievers, which we already saw that. She won't take them, right?
I won't take Tylenol. I won't take ibuprofen. I won't take anything until I'm in dire need.
But hey, wouldn't it be better if we could just avoid cellulitis altogether? Ambi would certainly love to avoid this disease. Here's how. Keep those wounds cleaned. Promptly clean cuts and scrapes. Slap on some antiseptic and cover them up. Personal hygiene is your best friend. Wash those hands regularly.
If not the whole 2019, where I literally couldn't shower.
Why, yes, I did cut some pointless breathing and dramatics out of that clip. You're welcome.
Destiny saying that I didn't shower while living with her mom is absolutely 100% her telling the truth.
And moisturize, folks. Hydrated skin is happy skin and less prone to letting in unwanted guests. Now, none of this is likely something that you and Ambi doesn't already know, but like Ambi says...
And the thing is, cellulitis does not only affect obese people. I know a lot of people think that, which means that you don't have the knowledge of people with cellulitis, like you don't know a lot about it. Yes, a lot of morbidly obese people do get cellulitis, but so do skinny people.
Now, I will not sit here and say that only obese people get cellulitis. It just isn't true. However, in a 2019 study, it showed that the obese are significantly more likely to not only get cellulitis, but to be hospitalized for it. You see, obesity can compromise the immune system, and a weakened immune system is like an open invitation for cellulitis-causing bacteria. The excess fat tissue in obese individuals may hinder the immune response, making them more susceptible to skin infections.
I have lymphedema, I have lipedema.
Now, Ambi, don't get ahead of me. We will get to your 2 big L's in a video soon enough. Now, it doesn't end there. Obesity often comes with its own set of challenges, like skin folds. These folds can create environments conducive to bacteria growth. Moisture and warmth trapped in these areas become a breeding ground for bacteria, increasing the risk of cellulitis. Obesity is often associated with conditions like diabetes.
Oh my God, does Amberlyn have diabetes? I bet she does. I know she does. She should.
People with diabetes are at a higher risk of developing cellulitis due to compromised blood circulation and nerve damage, common complications of the disease.
So it turns out that I am losing a lot of circulation in that leg.
Sadly for the obese, it is the same thing that will help them that help those pesky skinny people, and that is hygiene, something that our girl always seems to struggle with, even now with her stacking dry shampoo mile high. My prediction, cellulitis incoming.
Shampoo, and it makes my hair look gray before I take it out. So this is how I'd look with some gray hair. I need to fix my hair. It's still a mess, but I literally just sprayed this.
Of course, I could talk about all of this over and over again with you, with her, and it will not matter, will it? She will continue to get it because not only does she refuse to practice good hygiene, but she also refuses to take proper care of herself. In order for her to reduce the time that she gets cellulitis in a year to around the times that she takes a real shower.
Are y'all still there? Hello, are you still there? Okay. All right. We are clean and pristine. Oh, we're smelling good. We're feeling fun and fresh. Hello? Is anyone home?
The answer is going to be weight loss and proper hygiene. The one thing I will not say is that cellulitis is something easy to overcome or easy to treat, which is very good because we get little updates that she is just taking meds and everything is so much better.
But it's just like with cellulitis, I can't leave the house or anything, but I'm finally feeling better.
As I have covered, it is extremely dangerous if left unchecked. But it is even harder to overcome when you are Ambi and have had it numerous times and know better than anyone. The doctors, the nurses, even though you credit them with saving your life from cellulitis when you were a teenager. And it is certainly not something that you would use for content or filler in a Lego video.
But sadly, I ended up getting cellulitis, which I still have. And usually you're supposed to be resting. But my cellulitis goes away really fast because every time I feel a symptom of it coming, it's like, oh, I know exactly what's about to go down. So always catch it fast. So that means it goes away fast.
Poor Ambi's going to have to find herself a new wipey to get into those folds to avoid those skin cracks. I wish the best of luck to her.
Come here.
Yeah,
Such a fucking lie. Oh my God.
that is not.
Not necessarily Ambi, but to whoever's unfortunate enough to have her help before she gets to the great big number 11.
Gallstones.
Gallstones.
Let's shed some light on what gallstones are. Gallstones are solid particles that form in the gallbladder, a small organ that plays a crucial role in digestion. These stones vary in size and composition, causing discomfort and complications. However, a lot of times gallstones never even have symptoms and can even go unnoticed, though everybody is different.
Oh, you're too young to have gallstones, but I knew I had them. The attacks were horrible. After a couple tests, I was right. It came back that I had gallstones.
The bigger risk is,
Your gallstones get worse. Your gallstone will go into your intestine and it will go to your liver.
well, yes. I too am terrified of fictitious things, Amber. The idea of Cthulhu still terrifies me. Well, other than a certain kin, anyways. Because they do not go into your liver. What happens is that they can block the bile ducts that can lead to your liver or pancreas, causing an infection. But I'm sure that's what you meant, right?
No.
Yes, exactly what you meant. Now, just like cellulitis, Amber has said that skinny people get gallstones as well. And she's correct. They do. However, there's research that shows a significant association between gallstones and our 500-pound girl. And there are several factors at play. First and foremost, obesity can lead to an imbalance of cholesterol levels in the body, a key contributor to the formation of gallstones. Additionally, metabolic syndrome, often prevalent in individuals with obesity, increase the risk of gallstones.
To make a long story short, I pretty much had to force the emergency room to take an ultrasound because I knew I had gallstones, but their hearts were set on, oh, you're too young to have gallstones, but I knew I had them. The attacks were horrible. After a couple tests, I was right. It came back that I had gallstones.
Speaking of tests, there are many different tests that can be done, and you depending on one is interesting because there's about 7 they might give you. I would be fascinated to know which one you received to confirm gallstones. An ultrasound, an HIDA, a CAT scan, an MRCP?
Googling.
Ah, I see. Well, moving on. Now, how does being a queen like Ambi increase your chances of gallstones? Well, it can hinder your gallbladder's ability to contract and release bile efficiently. This sluggish movement can create an environment conducive of the formation of gallstones.
My stomach hurts, my gallstones hurt, and just everything else.
But there's good news, Ambi. If gallstones are not causing symptoms, you don't need treatment for them.
Pain is atrocious.
Oh, well, they will likely treat it right away if you have them, and there are many ways that they can do that to ensure you are safe and ready for your next binging session. More good news, there are steps you can take to reduce your risk. Adopting a healthier lifestyle is paramount. A diet rich in fiber.
I have candy. I have Twix. I have Snickers. I have a Simply Caramel Milky Way. And a regular Milky Way.
Low in saturated fat.
Oh my god. And no, I'm not a troll. Oh my god, that's like a new thing.
And coupled with a regular physical activity regimen, can significantly lower your chances of developing gallstones. But I know what you're all thinking. Nerfy, what about her gallbladder sludge? She was diagnosed with gallbladder sludge too. That's right, she was.
I was diagnosed with sludge in my gallstones, which is something completely different, and I let him know that.
Now, the reason I let it play to that point, that she said that it was caused by rapid weight loss, is because 1, it makes me smile, and 2, because I love to see her think on her toes since she can't do very much on them anymore. There can be many causes to gallbladder sludge, and as we can see, our girl only mentioned 1, so let's go through them, shall we? Alcohol abuse.
Okay, hello. So I finished my dishes. Your girl is a little red. I'm having a buzz ball. This is actually my second one. I'm probably just...
A buzzball. Judging by the red in your eyes, it is more than one. Well, we have something to look forward to now that she's drinking like a fish. Drinking like a whale. Previous gallbladder issues. Specifically, gallstones. You know, that thing you complain about and bring up every time you have a stomach ache. Stomach surgery and organ transplant, which we know didn't happen when the sludge was happening, or we would have heard about it other than maybe the hysterectomy. Some medications, but our girl doesn't take meds.
If I'm prescribed something and if I truly don't have to take it, I won't take it.
I was raised around drug addicts, Amber, and that's why I don't take what they prescribed, but I tend to listen to my doctors. Restrictive diet.
And more realistic. So we're gonna just try it out.
Sorry, Sorry, I forgot who I was talking to for a moment. Rapid weight loss. Look, Ambi, you weren't lying. It is rapid weight. Oh, wait. There is another one. Obesity. Yes, it can be caused simply by being obese, which you are. For shame. We are not your doctors, Amber. You cannot cherry pick what you tell us. We have Google too. And honestly, I'm not even going to touch on the Ozempic part here, other than to state this. Everything everywhere says that if you have a history of gallbladder issues, you must inform your doctor because Ozempic can make it worse. You have been having gallbladder issues for 9 years at this point, so either you didn't tell him or you played it down. The ways to treat this is usually a change of lifestyle and diet, which, let's face it, is never going to happen. So it always amazes me how it just fades away into nothing when she got attention and she's fine now.
The fact that I knew that before being told that, I'm 32 years old. I don't think I could go to college to be a doctor at this point. But it's I feel like in my past life I was a doctor or a nurse, or I just watch a lot of Grey's Anatomy, so I know.
Now, to round this video out, I want to just touch base with Dr. Lynn.
I feel like I'm Dr. Lynn. I just know things, feel things, sense things. So
she knows better than anyone, it seems, and knows her body better than any other human out there. While I do agree you should know your body and know it well, it should not be practiced the way Ambi does it. I also agree that Ambi doesn't doctor shop for drugs, so we will not be including that explanation in this section, but it is there.
So, if you don't know what doctor shopping is, I'm going to explain it to you. It is where you get different doctors, you make false claims of your symptoms to get prescribed medicines from several different doctors.
Not all doctor shopping is illegal, Ambi. In fact, the kind that is defined as a patient withholding information, falsifying symptoms, or otherwise engaging in fraud to get prescriptions for controlled substances. This doctor shopping is a crime under federal and state laws, and it helped fuel the opioid crisis. So that is the law, but what is the definition? The full definition is doctor shopping is a phenomenon that entails patients seeing multiple doctors or clinicians. The patient behavior is typically associated with negative connotation among treatment providers. You know, Ambi, like this.
Yesterday when I was at the ER, they specifically told me, if you get any worse, come back. Well, I'm not going back to you, baby. I'm going somewhere else because I feel like if you go to the ER, you should, get the test done to be the deciding factor of what's wrong with you. You should never leave the ER oh, you're fine, you're just in pain in the most weirdest spot ever. It just doesn't make no sense to me. Everyone that I've talked to about this has been like, what? That doesn't make sense.
Or this.
I honestly might see another doctor. I'm not joking, because I want to see, I just want to see as a whole what 3 different doctors will say about what's going on. And if I have to, I'll see a 4th one, because this is really important to me, because these symptoms are honestly, truly messing with me.
That kind of doctor shopping. Now, we all know how much our Ambi is respectful and loves doctors.
I do feel like sometimes they're a little greedy, and I just want to say that the main doctor we saw for less than a minute, was practically falling asleep. I'm sure he's had really, really long hours, and I'm sure he's had mean patients, and he's seen some crazy things, but I really believe that when you're a doctor, you should be a doctor not for the money, not for the privileges, not for anything other than the fact that you want to help people, and I just feel like they didn't help us today.
At this point, I am not sure if you understand what an emergency room is. An emergency room is not there to make sure you're all better and ready to go. Here in the US, it is usually here to make sure that you are not dead or dying, and then tell you need to go to a normal doctor. That is what they are there for. emergencies, not stomach aches, Ambi, or a pimple in your belly button. Okay, calm. Now, what are the factors to determine doctor shopping? The first is obvious, drugs, but Ambi doesn't take meds, so we'll remove that one and set it on a shelf like one of her fan-made items she barely thanked anybody for and forgot about.
Yeah, so many things. Do you guys remember? Stream Queen. Oh, should I bring this back? Should this be a moment in time?
R.I.P. the Stream Queen Cup. Another factor is shopping due to illness variables. This is usually because of a lack of understanding of what the illness is, and they do not understand or agree with the diagnoses that is being given to them.
I honestly might see another doctor. I'm not joking, because I want to see, I just want to see, like, as a whole, what 3 different doctors will say about what's going on. And if I have to, I'll see a 4th one, because this is really important to me, because these symptoms are honestly, truly messing with me.
Another is a psychological dysfunction, which is completely believable. This is on a broad clinical level and is usually because the person is seeking attention or gratification through a diagnosis. And lastly, we have the physician-related factor, which consists of the doctor not being open or having a high standard of their patient.
Normally, I would just wait to go to my doctor.
So, is she doctor shopping? Yes, she always doctor shops, because as soon as one tells her something she does not want to hear...
So I was like, well, do I have, stuff on the side? Do I have, like, veggies or whatever, like broccoli? And he was like, yeah, that's fine. But he was like, make sure you don't have a lot of it because it's filled with tons of carbs. And I was just like, okay. And not have to eat those? Cool. Because I should believe everything a weight loss doctor says, right?
She moves on to the next one.
So, an update on my doctor's appointment. So, this was a new doctor and I loved him.
And much like her relationships, they go through a honeymoon phase. Not only these examples, but during her weight loss surgery journey, she actively left one doctor's office because of a BED diagnosis. Don't worry, we're getting there. Hunting or shopping for a doctor that would give her answers that she wanted, the procedures that she wanted, the steps that she wanted, and how it was all going to work in the time frame that she wanted. I am not inserting any of those clips because of her weight loss surgery journey is problematic at the best of times, and she guarded it close to her chest. But she knows, and a video on it is coming. So do us a favor, Ambi. Do not sit there on your high horse and tell us that you do not doctor shop. And there you have it, folks. My first installment of Ambi's mini ailments. I know this video might be just a little bit rough, but I do hope you enjoyed it. The research process and everything was grueling, but it was very rewarding nonetheless. I am hoping for many more in the series, along with a few specials in the works that I'm working on right now. A big shout out to a certain creator here in Girl World and their Discord for keeping me motivated, helping me with scripting and structure, and all around being awesome. You all know who you are. And remember, folks, if this woman tries to give you medical advice, do not take it. Do your own research, and I will see you in the next video. Bye!